Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you. Dr. Jeff talks love.
Jeff, you're muted.
Welcome to Dr. Jeff Talks about sex and intimacy. We're so glad you're here. This is the podcast where we get real and we get factual about the truth about sex and intimacy. I'm your host, Dr. Jeff Albaugh. Today, you're joining us for episode 60, Untangling Male Pelvic Pain, Pathways to Healing and Sexual Health. Whether you're watching live or listening to the recording later, every moment of your amazing life counts, and I count it a true blessing and gift to have you joining us to improve your life. I sincerely thank you. Thank you so much for being here. You're why this podcast exists. Well, we're connected across so many platforms: Facebook, YouTube, X, and LinkedIn. If you're on X and you want to submit a question, just pop over to one of the other platforms and you can do that. A quick favor, if you are a Facebook person, please follow us on Facebook. The more people who follow us, the more we can do on there. Visit the website if you haven't so far. You can watch any of the other 59 episodes, this one too after this evening, and you can pull up the calendar, see what's coming up. We have so many great episodes coming with awesome episodes, with awesome speakers. So I can't wait for you to hear all their expertise and join in on that. So visit the website. Now, you can also, we're going where you go, so you can stream us when you are in your car, when you are working out. We can be there with you. Bring Dr. Jeff Talks about sex and intimacy with you, whether you're on Spotify, Amazon Radio, iHeartRadio, and wherever you are, we're there with you. As always, I like to remind you at this point that everyone is really, truly welcome here. Whatever your sexual orientation, whatever your sexual identity, your relationship style, this space is for you. It was created for you, and you are so welcome. The mission of the podcast is really simple. It is just to empower and enlighten you with the evidence-based, that's the scientific-based information you need to make informed choices to improve your sexual health and to deepen your relationship so you can live your one miraculous, wholehearted life with more love. So today we're taking on a topic that affects millions of men, yet it's often misunderstood, and frequently men suffer in silence. The topic is male sexual pain. Pelvic pain is specifically what we're zoning in on, and it can touch every part of a man's life: comfort, confidence, relationships, sexual health. It's rarely just one thing, and many men bounce from provider to provider without clear answers. It seems like you're just going all over the place and not finding the information you need. And so this episode, Untangling Male Pelvic Pain, Pathways to Healing and Sexual Health, is going to be a really good one. And I can't wait for you to meet once again. She's been on before, but we welcome back Dr. Susanne Quallich. She is here to help us make more sense of the causes, the myths, and most importantly, the real paths towards relief with pelvic pain. We'll talk about connection between pelvic floor muscles, the nervous system, stress, and sexual function, and how men and their partners can move from frustration to hope and healing. That's what the show is about. So my guest today, Susanne Quallich, is a nurse practitioner, researcher, and educator, and she has dedicated years of experience specializing in men's health. urology, and sexual medicine. She's nationally known for her work in male pelvic pain, chronic prostatitis, pelvic floor dysfunction, and the complex interaction between urinary, bowel, and sexual health. Dr. Quallich has authored numerous publications. She is the editor of Urologic Nursing. She lectures widely to health professionals and has been a passionate advocate for evidence-based compassionate care for men whose symptoms are often these symptoms are minimized or sometimes misdiagnosed. Her clinical approach integrates medical assessment, pelvic floor rehabilitation, behavioral strategies, and attention to intimacy and relationship concerns, helping men to regain function, comfort, and quality of life. Who doesn't want a better life? So I am really excited to welcome Dr. Susanne Quallich. Welcome. Oh, now you're muted. We're having a problem with muting tonight.
Oh my gosh. There. Okay. There we go.
Yes.
Thank you.
So good to have you back. I'm so excited.
Well, I thank you for that kind introduction. I'm listening. I'm like, she sounds kind of cool.
She is cool. She's totally cool.
And, and I just want to say, I can't thank you enough for inviting me here to talk specifically about this topic. Because to your point, as you said, sometimes these complaints are very much minimized. You get there's a lot of information, I think, among providers and non-providers, patients about female pelvic pain. But male pelvic pain is kind of newer into our sort of our clinical vocabulary over the last maybe like 10 years. Used to be historically anything that happened in that area was prostatitis and you got antibiotics. And the problem was men didn't get better. And then finally, with evidence-based and some studies and a big study that was a big multi-site study that went on, we finally got smart enough to realize it's not the prostate. This isn't all about the prostate. It's about everything that's going on in that pelvic region, in that pelvic floor region. So yeah, I'm very excited to be here and talk about this.
I think it's such an important topic. And like you said, I've seen studies that said a lot of these patients will see like 4 to 7 providers before they get any kind of information or results with these problems.
Yeah.
So I cannot wait to hear all the great information you're going to supply. So I'm going to hand it over to you, and it's all you now.
All right. I can do that. All right. So we have the title slide. I am assistant professor of urology, so kind of unique in the nurse practitioner for nurse practitioners. So I do have a role that's pretty pronounced within our department of urology. And just to throw it out there, as we've kind of already hinted at, both sexes, all sexes, experience pelvic floor symptoms. You can't get away from it somehow. But research on pelvic floor issues for men has not been a big subject for research. And so we don't know as much about how the symptoms present in men as we do for women. There's a big body of research out there that tells us what to do and where to go and how to interpret pelvic floor symptoms for women. What this translates to is exactly what Dr. Jeff has said, that you see 4, 5, 6. I think there's been more than one time where I've been the 8th or 9th provider that someone has seen because they're looking for someone who has the expertise and the interest in trying to figure out what's going on. And pelvic floor symptoms typically have been treated in this only from a urology, only from a prostate infection standpoint. And like I said, we've gotten smarter and we realize that this is not really the way to go, that there's so much going on in the pelvic floor that we need to take a step back and see, can all of these symptoms be explained by the pelvic floor? Can we chalk this up to a bigger chunk of real estate than just the prostate? And the answer to that is actually yes. Going along with that is that why would anybody spend time and energy and effort to go to 4 or 5 different providers? Pain, bottom line, pain in any way that it presents is the most common reason that patients seek care. So you're out there, you're trying to understand what's going on. It's hard to live in pain. And it definitely impacts your day-to-day life. And in this context, with the pelvic floor, it impacts your ability to sometimes urinate, but certainly to pursue sexual activity and intimacy, which is where we're going to kind of focus on this. Very, very costly as well. I just put those up there. They're old numbers, but just to again drive home that idea that this is it is a public health issue. Chronic pain of any kind, including pelvic pain. So when we typically see men with pelvic pain, they have a lot of variety of symptoms. And you may be looking at this list saying, "Oh, I have a couple of these," and am I someone who maybe should be evaluated with for pelvic pain? Well, hopefully, as we go through this today, you'll be able to answer that question and kind of see if what's happening and the symptoms that you've been experiencing fit into this male pelvic pain picture. But you can have scrotal pain, penis pain, generalized pain in the pelvis, lower quadrant pain, so lower abdominal pain. Sometimes men will have urinary symptoms. Oftentimes they don't. Sometimes they have rectal symptoms or bowel symptoms. Sometimes they don't. And some men have more of a widespread pain pattern. So they may also be getting things like migraines. That sometimes are associated, or a lot of times irritable bowel disease will travel along with what we consider a more urology focused pelvic pain. But really, what we're looking for is this idea that this has been going on. These symptoms, this pain has been going on for at least 3 months, and no one's been able to sort it out. Why do we bother? It goes back to this idea. Men are spending a lot of time trying to find a provider who can sort this out and provide an answer. That incorporates a lot of frustration because you want to find an answer. We're all, sometimes it's almost a relief if someone gives you a UTI diagnosis or a sinus infection diagnosis. Those are things we can all kind of have some common connection with. But there's also the financial burden. If this keeps you from doing your job, that can create a financial burden. If it keeps you out of work because you're traveling to appointments or getting different x-rays and MRIs and things, that's a financial burden as well. So this is why we try and sort this out and really empower patients to kind of help us by detailing their symptoms as much as they can. And that's why presentations like this are so important, because it's taking the information to where it needs to be sometimes. So when we look at this idea of pelvic floor dysfunction, no one can sort of sort this out in terms of men. It's all over demographics, it's all over ages, it's all over socioeconomic categories. So it really could be anyone. It could be your next door neighbor. It could be your friend down the street, or the guy you see when you're grocery shopping. What this does is create a high psychosocial burden. I can tell you there are a lot of social media sites for this, where patients get together and talk about their symptoms. And that helps relieve some of the psychosocial burden. But on the other hand, it can also create a psychosocial burden. If you hear about other people's bad experiences, then you can start to think that you're stuck going down that same sort of path. When we talk about this, again, there's a lot of real estate. I'm going to show you a picture in a minute or two here. These are all the different areas that you can have pain in the penis, pain in that perineal area. Basically, if you think about sitting on a bicycle seat, it is every part of your body that's in touch with that bicycle seat. But it also can include your hip flexors. It can also include your abdominal stabilizers. So there is just a lot of things that can contribute to pain in this area and take you down this pathway to where there's some sexual dysfunction. Putting it another way, the pelvic floor is, a lot of the times I explain it as a sling or a hammock that goes from that pubic bone in the front and connects with your tailbone in the back. And so it's a big area, and it's a lot of big skeletal muscles that are just holding everything up in your pelvis. And it supports those organs, but it also is important to think that it never gets a break. Every time you sit, stand, sneeze, urinate, have an erection, move your bowels, your pelvic floor is engaged in some way. And that's what can make the pelvic floor, diagnosing pelvic floor issues so challenging, because a lot of the times one of those functions is more problematic for an individual patient than the other. So if you're primarily having urinary symptoms from the pelvic floor, you're seeing a urologist. If you're having a lot of hip flexor tightness, you may be seeing orthopedics or physical therapy or a physical medicine provider, but it's a little bit more expansive than that. So that's part of the challenge with pelvic floor dysfunctions. And also in the context of tonight's, I guess you may not be listening to this at night. It is night for me. It aids in sexual performance and specifically erection and ejaculation. And that's where you can have some pain with those from contributions from the pelvic floor. So this is, again, what we're talking about, trying to orient you to the area that we're talking about if you're not totally familiar with it. But you can see that when you urinate, everything passes through the pelvic floor. You move your bowels, passes through the pelvic floor. And I think from the picture of the musculature, you can start to get an idea of just how many muscles are in this area. As I said, remember, sitting on a bicycle seat, everything that you have touching the bicycle seat is part of your pelvic floor. There are a lot of different reasons for issues with the pelvic floor. Some of them are a little bit more straightforward than others. Certainly, if you have an injury, sometimes even just coming down hard on a bicycle seat. We keep talking about the bicycle seat. That can set you up for a little bit of pain in that area. Sometimes it's a little bit big contributions from the hip. If you have a hip injury or you have some hip arthritis, it can throw off how your pelvis is sitting. And so then it can set up some of these muscles to not be as coordinated in the way that they work. There's also this idea of psychogenic pain or some other issues like depression and anxiety that can contribute to pelvic pain. And it may sound strange. The way that I usually explain it is that some people carry their stress or their anxiety and they get migraines. Some people carry stress and anxiety and have low back pain. Some people have pelvic pain, and sometimes you don't know that you're a pelvic pain person until you know that you're a pelvic pain person. So there's a lot of potential contributors, again, making this very challenging sometimes to sort out. There are some more concrete things that we can point at that can contribute to pelvic floor issues, prostate issues. We said that early on. Certainly an actual prostate infection can contribute to some prostate or some pelvic floor symptoms rather. If the muscles are not coordinating, if there's nerve damage or injury, if you had surgery somewhere in that general pelvic area, chronic conditions such as pelvic floor dysfunction or something called interstitial cystitis, which is a chronic bladder irritation. And again, stress certainly is a big contributor in this context as well. Sometimes there is a component of pelvic floor weakness where for some reason these muscles are not coordinating or not working the way that they should. And this list here, aging, obesity, being sedentary, it can be hard to work against those. I mean, we're doing so many things where we're in front of a computer all the time, and that certainly contributes to being a little bit more sedentary, and you want to get that pelvic floor and all of your muscles working. And then there are some conditions also that contribute to this, things like diabetes or other neurological disorders that raise the risk for a lack of coordination or difficulty coordinating those pelvic floor muscles. The other side of this then would be pelvic floor tension or muscles that are too tense. You may have had some experience where you had a lot of tension, maybe shoulder muscle. I know for me, sometimes that's a big one. And it's the same concept because these are the same types of muscles in that pelvic floor. And one of the big contributors that I have seen when I see younger men in my clinic is that if there's been a history as a teen or as a kid where they didn't like to go to the bathroom at school and they just kind of held onto that urine, held onto that stool all day. sometimes it's hard to get your pelvic floor to unlearn that behavior, and you can end up with pelvic floor symptoms. But again, you're seeing stress, anxiety play a role in here, urinary function issues. Either you have to feel like you have to go all the time, or you have trouble starting your stream. That can be a contributor to pelvic floor tension. And sometimes core training. We do see a lot of this high tone, what we call a high tone pelvic floor, particularly in men who do a lot of running, a lot of training running, and a lot of cycling training. So that's always front of mind for me if I find out that that's their chosen exercise pattern. Nothing wrong with it. It just can kind of tip the scale a little bit for you. So let's talk about this a little bit more specifically. Again, you're thinking like, could I be one of these people? Chronic pelvic pain, it's pain kind of all over, all pervasive in all of those muscles and all of this area that we're talking. Sitting on a golf ball, I think, is probably the best explanation I've heard from patients. They really do feel like they're sitting on a golf ball. And whether that's because there's some active involvement in inflammation of the prostate, or because those muscles are just so tense and you're so knotted in that pelvic region, it can go either way. And then here we are moving into the sexual symptoms that can come of this. Issues with erections. Pain with erection is a big indicator that we should be thinking about pelvic floor involvement. And pain during ejaculation is another big red flag that can cue us into thinking about the pelvic floor being a part of overall what's going on. When we look at this a little bit more, we kind of tease this apart. Again, we're coming back to this idea of issues or a change in erectile function, pain with erection, pain with ejaculation. But another symptom that we hear a lot is this issue of decreased sensation, or just a sense of something's changed with climax or erection. And these are all challenging to quantify for us to quantify because we can't measure it. We can't do a blood test. We're really relying on the conversation that we have in order to get a good explanation or get a good sense of what your experience is in this context. And then to make this a little bit more specific to genital complaints is that pain at the tip of the penis a lot of times, or pain really focused at the meatal opening. Now, I know that you're thinking like, wow, like that would be definitely something that would get my attention. And that's very true. It's very disturbing, I think, when people have this complaint, because sometimes that's all there is. They're until they find a provider that's familiar with this. Sometimes they're seeking care for just pain at the tip of the penis. And then talking a little bit more about some of the other potential symptoms, it becomes clear that this is not so much about the penis as it is about the pelvic floor. You can have pain to any of the structures in the genitals, excuse me, scrotal pain, testicular pain, complaints of kind of a burning sensation. And so our goal when we hear these concerns is to make sure that it isn't a sexually transmitted infection, right? Sometimes that can present as pain and burning. And so once we've made sure that those things are not a piece of this, then we have to kind of move on and put our thinking caps on to see what else it might be. Another big complaint that I've heard over the course of my time taking care of men with pelvic complaints are a lot of kind of unusual sensory complaints. And to me, that's always a big cue to think about, like, if we're having sensory complaints, where are these, thinking about where the nerves are coming from. The pelvic floor is a very richly innervated area. Again, if you have all those muscles in there, you also need nerves that are telling them what to do. So when we start to hear complaints of numbness or burning or cold, a cold penis, you again kind of start to think that maybe there's a pelvic floor component that's putting some pressure or some just causing some pressure or causing some spasticity in those muscles that's creating the sensation with the nerves. I often hear a sensation of fullness to the scrotum, even though there is no fullness in the scrotum. There is that sensation that's created by all of these symptoms that are going on. Excuse me. Decreased genital sensation kind of goes right along with this. So what this does is cue us into looking for things Testosterone is one of the things I always look for, because that is sensory complaints sometimes go along with a low testosterone, or an elevated testosterone, or an out of ratio testosterone to estrogen ratio. I do want to just take an aside, is that all men do have a component of estrogen called estradiol in their system. And one of the big roles that it has is to keep your bones healthy. So I don't want you leaving this thinking that we're worried that there's too much estrogen. You need some, and we can measure it. Some of the more specific sexual function complaints that we hear with pelvic floor concerns is there's a lot of changes that men are keyed into that have to do with that feeling of orgasm. Sometimes the intensity changes. Sometimes it's actually very, very painful at time of orgasm. Sometimes it's difficult to reach that point, particularly if it's painful. No one likes to do anything that's painful. Or sometimes it can be painful even after the fact. So anytime we have pain around erection and ejaculation, we really do start to think pelvic floor might be a big component here. It can also feed on itself. If it's distressful and you go into attempts at intimacy with your partner and you're really, really hesitant about, reaching the end, that can create distress for you. It can create distress for the partner. So we are cognizant that that's a piece of it. Fortunately, treatment in this context, oftentimes, pelvic floor physical therapy, you're going to hear me say that probably half a dozen times. And sometimes alpha blockers will help also if there's pain. So we do have some things that we can tap into, and we can recommend as in terms of trying to help with that particular symptom. Anejaculation is just our clinical way of saying unable to reach climax. A little bit different from orgasmic dysfunction. This is actually trying and hoping and not being able to get there. And again, we see that this can impact body image and attempts at intimacy. You can also sometimes with this, if the individual is able to reach climax, it's just not the same. There's a lot of complaints about how it's just not satisfying because it's very different than what they recall. Again, hard to treat. Sometimes requires a little bit more teasing out, but pelvic floor physical therapy is always a really good place to start. Premature ejaculation is kind of the flip side of this particular coin. This is a much more rapid ejaculation than than the individual or their partner may hope for. And we know that this is a relatively frequent occurrence. We don't have good numbers, but this talk is not really about numbers. Sometimes it's linked with erectile dysfunction, so actual difficulty getting an erection. And there are a bunch of different options that we can tap into for that. One of them is pelvic floor physical therapy again, but the medication options in this context are a little bit different. For anybody who's really, really invested in looking that up, I've included the website where you can get some more information on that. Overall treatment options for pelvic floor concerns and pelvic floor dysfunction are going to be lifestyle modification. So if you can identify stress, for example, then it might be worthwhile to go down that route towards therapy. And there are actually a lot of good online therapy options that are a whole lot more convenient than going to a brick and mortar place for that. PDE5 inhibitors, these are the medications like tadalafil or sildenafil, so Cialis and Viagra, widely available from online vendors, from your local primary care provider, local urologist, whoever you may be seeing. Can be very successful, particularly if there's a component of erectile dysfunction in this. Alpha blockers, those are medications that are designed to relax the prostate. And so if you have urinary symptoms that go along with this, they can help address and improve some of the urinary functions. 5-alpha reductase inhibitors, those do play a role in this. Those would be medications like finasteride, but they're not what we would consider first line. We would try the alpha blockers. We would try the PD5 medications. Anti-inflammatory medications are always a good option in this context, because remember, these are big skeletal muscles. And if you are working out and you have sore muscles, you're going to take ibuprofen, Advil, Aleve, whatever you have about, and Tylenol, acetaminophen, always a good option in this context as a trial to see if it helps improve your symptoms. We do have options of other analgesics, including specific urinary analgesics. Things that would work to decrease inflammation in the bladder if that's a significant component. We can use other medications that specifically target nerve pain. We talked a lot about kind of sensory changes. Sometimes that is the best route for a particular patient, to look at some of these nerve medications that can be very helpful. And then this is a typo; it should say phytotherapeutics. So those would be things that you can get over the counter. Like turmeric is a good anti-inflammatory. Saw palmetto, some people get good results with that. So you can kind of tap into some of those over the counter treatments. There are also additional treatment options for when things don't work, or when the over-the-counter things don't work, when your attempts at self-treatment don't work. Sometimes you do need a psychology, either for more specialized therapy towards anxiety and depression, if that's a piece of what's going on, or more specialized sex therapy, if that's a bigger component of what's going on. This ESWT or TENS, these are like electrical stimulation of the nerves. These specialized pelvic floor physical therapists can actually do some localized electrical stimulation sometimes of the nerves in that area and the muscles to try and get them to relax. Acupuncture sometimes can be very helpful. Medications, again, we've talked about that a little bit, and same typo, at least I'm consistent with my typo. Surgical interventions, sometimes there is enough going on that surgery is actually relevant. This could be in the case of a man who has such a big prostate that it's really crowding out everything else in that pelvis. One thing I didn't say before, usually I say like kind of upfront, is that if you hold up your fist, that's about as much space as you have in your pelvis. And in that space, you have to fit a prostate, you have to fit a bladder, you have to fit a rectum. And so you can imagine that if your prostate is getting very large, it's kind of pushing everything out of the way and then putting pressure on some of the nerves and muscles in that area. So sometimes a prostate surgery can actually help address all of these symptoms. And then last but not least, and not necessarily least, but referral to a multidisciplinary pain clinic. Sometimes there are very good reasons that urology, I work in urology, and that urology is not the right place, or no longer the right place for management of the symptoms. As I said, we want to make sure that there is no urology issue that we can successfully address, but sometimes it does require some of our colleagues in other disciplines to help manage symptoms. So what sort of, you're saying to yourself, well, what sort of can I prevent this? I don't want pelvic pain. And I think that's a very worthy goal. If you are someone who seems to hold a lot, or you have a job, or you just forget to go to the bathroom, whether that's urination or moving your bowels, sometimes I will remind people, put a timer on your phone. Try not to go more than 3 or 4 hours without urinating. If you even, give it a try, even if you don't feel necessarily like you have to urinate. Like we always say, an empty bladder is a happy bladder. Because remember, if you got a full bladder in a space like this, it's going to start to put pressure on all of the other things that are in that pelvic area. Pelvic floor exercises can be very helpful. Maintaining a healthy weight is always good. You have less pressure of just abdominal fat kind of pushing down on everything that's in the pelvis. Physical activity is never a bad recommendation. All of the other chronic conditions. So if you do have issues with an enlarged prostate, if we can get those symptoms addressed, sometimes that can help with the pelvic floor symptoms or erectile dysfunction symptoms. And then certainly if it's been suggested to you that you do have maybe a tighter pelvic floor, if you start to have urinary or bowel symptoms, you want to cue your provider team into that. and say, hey, I think I'm having some of these issues, and maybe we're able to intervene a little bit earlier and preventing some of the downstream things that we can see. So, kind of in summary, a lot of different things go on in the pelvic floor. The pelvic floor, like I said, is a lot of real estate. It includes a lot of organs, a lot of vasculature, a lot of nerves. And so sometimes if they get trapped into a cycle where they're just not working in the coordinated way that we need them to, you can get a lot of these symptoms. You certainly get a lot of sexual function symptoms. And so the two big symptoms, pain with erection, pain with ejaculation, that can be an indicator that there is a pelvic floor issue. Is it true for everyone? No, of course not. But if other things are not helping to address that pain, it might be time to think that there's a pelvic floor component. Some of the other things that can influence pelvic floor symptomatology, life events. I've seen more than one patient in my clinic who's had some stressful life event, and they really did kind of internalize it in their pelvis. So that can be a component. That's where it's so important to kind of talk about what was going on when anybody first starts to notice these symptoms. And then in general, things that can also impact sexual function. So things like diabetes and high blood pressure, we know those are connected with erectile dysfunction. And so we want to keep an eye on those other things that could be contributing also. And I'm going to say that there's no way for us to predict which drug is most likely to be most successful in treating your symptoms as an individual with male pelvic pain. So sometimes it may not be necessary to see 4 or 5 providers, but you may need to see one provider 4 or 5 times before we come up with the best or most effective regimen for you. And I think that is my last slide. Yes, that is my last slide because it is not advancing anymore.
Awesome. Great. Such good information. I was thinking that a couple things. So often, like many things in medicine, it seems like we have to eliminate a lot of things that it's not, which I think for patients can be, the good news is it's not a sexually transmitted disease. It's not this, it's not that. But then they're like, then what is it, right? And that's where their frustration comes in, because they're like, okay, we've eliminated a bunch of stuff, but it still hurts. And why does it hurt? So I think that can be a real source of frustration for our patients who have pelvic pain, and difficult for them to discern how to navigate their way through that.
Yeah. And, this is where sometimes the internet chat rooms and the subreddits are a blessing and a curse, because sometimes it can get men kind of on the right path. But yeah, I've also seen my fair share of patients who have gotten some terrible advice from some of those sources as well. So I like anything else, you have to evaluate the source. There are some really great sources for information about pelvic pain. A lot of different hospital systems will have their own kind of prepackaged information that they provide. Certainly, I have a whole collection of things that I share with patients. But as I said, blessing and a curse. Sometimes it does get you in the right direction, but sometimes it can increase your travel time to the right place, I think we'll say.
And I think, I always tell my patients, patience goes a long way, because it's a trial and error, trying different things and really being patient. Yeah. And I try to remind them it didn't happen in a day or two. It sort of has happened over a period of time, and it takes time to unwind it and to really work on it.
Right.
And even pelvic floor physical therapy often takes 4 to 6 months to really get to where they'd like to be and get those results. It just depends. But so I think patience goes a long way with this. Anyway, we have a couple good questions that came through. My partner tries to be supportive, but I can tell this is affecting our relationship. How can couples navigate pelvic pain without intimacy disappearing?
Wow, that is such a fantastic question. I think the fact that there seems to be acknowledgement on both sides of that equation is a huge start. It sounds like you have a relationship where you can have these conversations, and that's a huge that's a huge start. The other thing is if you're aware of how this has been evaluated in the past, I mean, maybe this has given you some tips to go back to your provider with. For example, one of the most effective medications sometimes we see is taking tadalafil or Cialis every day. That can definitely help because it just helps relax. It seems to help relax everything in the pelvic floor for men. So if you feel comfortable approaching you as the individual, or having your partner, suggesting that to your partner, sometimes that's a great option as a first try if other things haven't been so successful. Sometimes you need a little bit of chemistry literally in there to help.
Yeah, and I do think like incorporating that your partner into your visits, into your care, so they feel a part of it and know, because then sometimes everybody's a little freaked out because your partner's like, I don't want to hurt you. I don't want, and then you're like, but you still want intimacy, you still want sex. And so
Right.
just having some conversations around it to say, hey, I really want us to be intimate. I love our intimacy and I really enjoy our time together. And I'll let you know if something hurts. It's just starting the communication around it and making everybody feel a little more comfortable when they're a little freaked out about it, because of the pain aspect of it.
Right.
And then I thought this was another really good question. I've been told my tests are normal, but I still have pelvic pain. It makes me feel like my pain's not real. And I hear this all the time from patients.
So do I.
Right? We've negated, it's not this, it's not this.
Right.
Your pain is still real. There's no doubt about it.
Yeah.
So they're saying, how do I deal with a problem that is not really validated on imaging or lab work? It feels
well, if you're close to Michigan, come see me. But
yeah.
But sometimes it really is you just have to, the way that I phrase it, sometimes you have to bump into the right person. You have to bump into that person who has an interest in these sorts of issues, which we would call a lot of non-operative urology, but also has a history of kind of success with it. It is that, and I hear that every day. It breaks my heart every day. But sometimes you do just have to run into that right person. There are more and more research. I'm not going to say there's a lot, but there are more and more resources out there for males with pelvic pain. And your best bet is to just kind of hunt around and find someone with working familiarity of it. And again, hopefully the fact that you're here listening to this tonight gives you some additional insights, maybe to go back to your provider team with and say, hey, I'd heard this talk and I'd like to try pelvic floor physical therapy if you've not tried it before. Or, hey, could you refer me to a pain clinic so that I could talk about medications to manage pain? Pain clinics sometimes have a stigma. I think we all have a little bit of a stigma about a pain clinic, but I have to tell you, they can be wonderful places. You may need medications for pain that we would not prescribe from a urology clinic. So that may be what you just haven't gotten to that person yet. You haven't bumped into that person yet. Pain clinics can also be fabulous places for trials of blocking some of those nerves that are in the pelvis. Again, that's not usually something that we would do in urology. And so you have to bump into the right person. You have to get to the right provider who can give you some different options than what you've had before.
I think too, if the listeners kind of to help them understand, because sometimes you're like, well, why do I necessarily see typically more often someone like an advanced practice nurse, a nurse practitioner, a clinical nurse specialist, or a PA, a physician assistant? And the reason is because the urologists in general are surgeons. And so the non-surgical work like this are things that are often done by advanced care providers like nurse practitioners, clinical nurse specialists, and physician assistants who are going to really spend the time and energy to help you figure out what's going on. Sometimes that may be a medical doctor, MD type person, but it also may be someone like that. And then, gosh, like you, I I can't underestimate the power of my amazing physical therapists who work with my
Oh,
patients and spend so much time with them.
yeah.
So it's just really finding the right team. And I love your
Mhm.
thoughts too, because our pain clinic at the VA and stuff, I just am amazed with what they're able to do.
Oh,
And
yeah.
it's
Oh,
not
yeah.
medicinal. It's such great stuff. They really pull
Yeah.
apart your pain psychologically, physically, spiritually,
Yep.
help
Yep.
you get to the brunt of it. So it's such a big deal.
Yeah, and I would add to that too, particularly listener, if you had a less than satisfactory, we'll say, experience with physical therapy in the past, find something different.
Mhm.
Because you just in the same way that you can see a nurse practitioner, you can see a clinical nurse specialist, you can see a physician assistant. Physical therapists also have different ways in which they are trained. And some of them get a little bit more intensive training in pelvic floor PT. Some of them get a different school of training in pelvic floor PT. So there are people who have different skill sets related to the pelvic floor. So don't be discouraged if you had pelvic floor PT and it didn't help, or you just didn't kind of gel with that particular person. I always encourage people to think about a second round of it.
Mhm.
Again, you just have to bump into the right person sometimes.
Yeah, and I've had a lot of people do so well with some of the non-traditional because we don't always have great answers. Western medicine has just as many flaws as Eastern medicine. So acupuncture and energy things,
Yeah.
there's so many different things they can do to figure out what's flowing, what's not flowing, how they can get things moving in a better direction. So I think if you're open to all that, you will find help. There's no doubt about it. And I think that's the greatest hope of what we're saying today is there is help. There is hope.
There's-
And there's so many approaches. A lot of people tend to say, well, there's not necessarily research, but there's great research around some of the Eastern medicine approaches too.
Mhm.
So, and all of our approaches have limitations. So I think if you're open to finding the right people and working with really
Mhm.
good qualified people, whether that's acupuncture, chiropractic, energy, whatever that might be, and
Mhm.
physical therapist, I think you can find solutions. You may have to think a little bit out of the box because when they're not finding anything in the box that works, you got to get beyond the box.
Yeah. Yeah. Yeah,
So,
and I will also recommend yin yoga.
mhm.
Sometimes people are just don't want to fuss with physical therapy, and I get that. And so, at least if you can find a yin yoga studio, that's a lot of focusing on hip and pelvic stuff. So I think that's it. That's a good adjunct if you're not not into traditional physical therapy. So there's always there's almost always something else to try.
Mm.
So don't despair. Don't give up.
So true. Gosh, so true. As we always do, I'm going to go to a centering exercise and we will come back and I will talk to you before we close. So I'll talk to you in just a minute. But as we do in each podcast, let's take a minute before we close. Let's take a moment to settle the body, the very place where pelvic pain often lives. Let's settle the body a little. Sit comfortably with both feet on the floor. Allow your shoulders to soften. Let your jaw become unclenched. Sit comfortably. Yes. Take a slow breath in through your nose and an even slower breath out through your mouth. As you continue to breathe that way, bring your attention to the pelvic region, that area, without trying to change anything. Imagine the muscles of the pelvis like a gentle hammock. With each exhale, picture that hammock softening just a little. No forcing, not fixing it, just allowing it. Every time you exhale, picture that hammock, that pelvic floor, just softening and relaxing into the chair below you. If pain or tension is present, silently say to yourself, I don't have to fight this moment. I can meet it with patience. I don't have to fight this moment. I can meet it with patience. Every time you exhale, feel yourself just relax and release a little further, a little deeper. Take 3 more breaths at your own pace. In and out. In and out. In and out. As you return to your day, remember that healing from the pelvic pain is truly, truly possible. And you don't have to navigate it alone. Just find the right people to help you, the right team. We really appreciate you joining us and talking about this challenging topic. Before we go, let's talk about what's up next week, Vic, on Dr. Jeff Talks About Sex and Intimacy.
In this episode, Dr. Jeff sits down with world-renowned couple therapist Dr. Andrew Christensen. They explore the powerful interplay between acceptance and change, 2 essential forces that help couples move from conflict toward compassion and deeper connection. Join us on March 3rd at 7 p.m. Central Time to learn more.
That is going to be a great episode. I spent a week in California with training with Dr. Christensen when I was learning integrative behavioral couples therapy, and he's amazing. And I've used a lot of his techniques in his work with my couples, and I know listeners will learn a lot from it. But today, gosh, so much great stuff you unpacked about pelvic pain and all the different things that can help that person with pelvic pain. So I think you've kind of given us a final message, but I want to give you one more chance. Is there anything that you would like to close with as a final message to listeners about pelvic pain?
I would say don't underestimate the role of stress. I can't emphasize that enough. Sometimes that is the answer. So if nothing else is working, take a step back and just think about maybe how much stress, or are you kind of internalizing all that stress into your pelvis?
So true. The stress and tension and trauma always show up somewhere in the body. And people think a lot of times, well, certainly we get it in the jaws, the shoulders, but people don't always realize it can show right up in that pelvic floor and be a real problem. So I hope, listeners, that you know after this amazing episode with Dr. Quallich that there is hope. There's hope for you. There is hope and there is healing. And my greatest prayer and hope is that you find that hope and healing with the right providers and with yourself. No one's better than you to help you heal. That's for sure. So we thank you for joining us and have a good evening.
Who's Dr. Jeff Talks About Sex